So let's talk about the specific chiropractic adjustment. So you've had a consultation, we've taken your history, we've done a detailed examination, we've done digital x-rays, and there's videos all about those if you haven't watched those yet. Then we'll do a specific chiropractic adjustment. And with headaches, we look at the entire spine, but most commonly it affects the upper cervical region, which basically means the top 2 or 3 bones of the neck. C1, C2, and C3, they're actually attached to your trigeminal nucleus, which is a special part of your brain or your brain stem. Your dura mater, which actually means tough mother. It's this envelope that surrounds the brain. It comes down and attaches into the bones in your neck. There can be tension, adverse mechanical tension on the dura mater and this nucleus that I've talked about, and also that affects the cranial blood supply. So even your blood supply to your brain can be affected when you have changes in the alignment in your neck. So remember, vertebral subluxations are deviations where the bones of the spine shift, put pressure on the delicate tissues of the nervous system, and can actually be the cause of headaches. If you have headaches that are caused by vertebral subluxations, nothing else that you could ever do. You could take every drug on the planet, you could even have surgery, you can do exercises, you can do stress reduction. If you have bones out of position, pulling on your brainstem, affecting blood supply to your brain, the only thing that will help you with that is a specific chiropractic adjustment. So a specific chiropractic adjustment is done as a result of the measurements that are taken from your x-rays that we talked about, the digital x-rays. So we measure exactly the displacement of the bones, and then either by hand, a very gentle movement where the bones shift back to the normal alignment, or sometimes we'll actually use adjusting instruments, which also can move the bone. And if you use either of those two things and realign the vertebra, put them back to the normal alignment, take the pressure off the nerve, it can have an amazing relaxing effect on the dura mater, the nucleus, improve the blood supply up into your brain, and actually correct the cause of why you're having headaches.